Good afternoon and welcome to our special report on gonorrhea in the Caribbean community. I'm Malika Poitel. Tonight we examine the rising cases of gonorrhea across CARICOM Nations, with the Bahamas reporting over 265 new cases in 2018 alone. This surge highlights the urgent need for awareness and effective prevention. We'll explore Neisseria gonorrhoeae, the bacterium causing gonorrhea, and discuss its transmission, symptoms, and complications. Additionally, we'll look at the strain on health systems due to antibiotic resistance and what can be done to combat this public health challenge. Stay with us as we uncover the facts about gonorrhea and how we can work together to prevent its spread. Let's start by understanding the bacterium behind gonorrhea and how it spreads, which will be covered by CARICOM.
Let's start with an overview of gonorrhea. Gonorrhea is a sexually transmitted infection caused by the bacterium Neisseria gonorrhoeae. It is a significant global public health concern, particularly in CARICOM Nations. Gonorrhea has been recognized for centuries, with its causative agents identified by Albert Neisser in 1879. Since then, diagnostic methods and treatment options have evolved, but gonorrhea remains prevalent worldwide. Now we will talk about the causative agents of gonorrhea, of Neisseria gonorrhoeae. It is gram-negative, non-motile, encapsulated, and it is found in the mucous membranes of the genital, anal, oral, and ocular regions. It is unable to survive outside the human host.
Now introducing Ebony Curtis with the modes of transmission.
Let's discuss gonorrhea's modes of transmission. Gonorrhea is spread through vaginal, anal, and oral sexual intercourse. The infection can be carried from semen, precum, and vaginal fluids. Gonorrhea can infect your genitals, to the male and female, the cervix, anus, urethra, throat, eyes, but that's rare. You can also get gonorrhea by touching your eye if you have infected fluids on your hand. Also, a baby can likewise come into contact with gonorrhea during birth if the mother is infected with it. Gonorrhea isn't spread through casual contact, therefore, you can get it from sharing foods or drinks, kissing, hugging, or holding hands, or on toilet seats. This is an STI, sexually transmitted infection. The only way to contract this infection is through engagement with sexual intercourse.
Hi, I'm Whitney Miners, and I'll be covering the symptoms, complications, and preventative strategies. So first, symptoms in men. Urethral discharge, painful urination, and swollen testicles. In women, it may include vaginal discharge, painful urination as well, lower abdominal pain, and abnormal bleeding. Complications include pelvic inflammatory disease, also known as PID, infertility, and ectopic pregnancy. It also can increase the HIV risk. Asymptomatic cases. Many individuals, especially women, may not show symptoms but can spread the infection. Here are ways you can prevent gonorrhea from coming to you. Use condoms consistently and correctly. Limit the number of sexual partners. Ensure that your sexual partners are tested and treated if necessary. You should have regular screening and testing for STIs. And the future development of vaccines is still being explored. Thank you.
Let's delve into treatment. Antibiotics such as penicillin and tetracycline were effective in treating gonorrhea. However, due to the development of antibiotic resistance, these drugs are no longer recommended as first-line treatments. The current recommended treatment for gonorrhea typically involves a combination of antibiotics, such as ceftriaxone administered by injection and azithromycin taken orally. This dual therapy approach increases treatment efficacy and reduces the risk of resistance development. With resistance to treatments, Neisseria gonorrhoeae, the bacterium responsible for gonorrhea has developed resistance to multiple antibiotics due to the overuse and misuse. This has led to the emergence of antibiotic-resistant strains, making treatment more challenging.
Now we will discuss the current impact on health systems. In the Bahamas, rates of sexually transmitted infections are high. In 2018, there were over 265 cases of gonorrhea reported. Between 2014 and 2018, there were a total of 1,181 cases. Gonorrhea can be cured with antibiotics, but the bacteria that are rapidly gaining resistance. This resistance means patients may need to take multiple antibiotics at once. This situation is particularly challenging for developing countries in the Caribbean with limited healthcare resources. The increasing resistance of gonorrhea bacteria poses a significant burden on the healthcare systems in CARICOM Nations.
Addressing gonorrhea in CARICOM Nations requires coordinated public health efforts, improved healthcare infrastructure, and ongoing research to develop effective treatments and preventive measures. Through awareness, education, and proactive strategies, the spread of gonorrhea can be curtailed, improving public health outcomes across the region. Together, through awareness, education, and proactive measures, join us next week as we can combat the spread of gonorrhea and improve public health outcomes in the Caribbean.